A very warm welcome to today's video. This is Dr John Campbell. He recently made a video about UK doctors murdering COVID patients.
Now, I'm going to keep this very brief because there's a serious national question I think we need to be asking ourselves in the UK that applies to the pandemic and ongoing into the future. Did more people die in the pandemic than needed to die? And did some of those die as a result of the medical interventions that were being recommended at the time?
He called it euthanasia, but euthanasia in the UK is illegal, and he knows it. So if you did it, you would be committing murder. He has come across a document produced 8 weeks after the first UK COVID case. It covers how to deal with COVID patients.
Now, I'm going to read you some guidelines that were published on the 3rd of April by the NICE organisation, which basically tells us what to do medically in this country. COVID-19 rapid response. So this is part of their guidelines here. Now, this is managing breathlessness. So this was published, remember, on the 3rd of April 2020. And they say this: consider an opioid and a benzodiazepine. Now, what they mean there is an opium-based drug like morphine, and the benzodiazepine they talk about is midazolam. Now, this is a classical, well-tried, trusted form of treatment that we use for things like terminal agitation, part of terminal care when people are dying of conditions such as cancer and things that are incurable, to manage a peaceful death, and it's completely the right thing to do in the vast majority of circumstances. But what seemed to happen was NICE just took that and transposed that into the COVID situation. And COVID, of course, we know is an infection, and most people can get completely better from it.
See what he did here? He goes to the section heading of breathlessness, then shows they are recommending certain drugs for treatment.
Now, this is managing breathlessness. And they say this: consider an opioid and a benzodiazepine.
Then he explains that drugs are used for patients that are dying, and the government is recommending drugs that are used to help people die to COVID patients who would normally get completely better.
Was this a fundamental mistake that they made, that they transferred guidelines for incurable conditions onto a potentially completely recoverable condition? It could well have been the case, because if you give these two together, that stops people breathing. Opioids and benzodiazepines will depress respiration, and given that a lot of these people that were breathless anyway had acute respiratory distress syndrome, and you suppress their breathing, so if you have a lot of fluid in your alveoli, you'll get a tachypnea, you'll breathe more quickly to try and compensate, and that can get you enough oxygen into your body to mean that you survive the acute episode. But if you give these drugs and you get respiratory depression, I don't think you need me to spell out the consequences of that.
So he's cherry-picked one section of the document to make you think the hospital gives these drugs to every COVID patient who is breathless. He's tricking you by not showing you the whole document, which is full of information about treating COVID patients. But he just showed you section 6.5 in the breathlessness section. And in that section, he forgot to show you 6.1 about managing anxiety, and 6.2 about relaxation techniques, the environment, and providing oxygen, and 6.3, which links to another guide on managing pneumonia, and 6.4 about investigating other causes of breathlessness. Nowhere else are these drugs mentioned except for the one section he showed, section 6.5, which is about treating dying patients. Now, he'll move on and note that the drugs are also recommended for end of life. But he says it's not possible to tell if, in fact, someone is dying.
So that's what they seem to do. This is the big question mark. So they said, consider an opioid and a benzodiazepine like midazolam combination for patients with COVID-19 who are at the end of life. But how many patients with COVID-19 would be at the end of life unless they had some intractable condition at the same time? And how do you know if they're at the end of life? With an infective condition, you can't really tell whether it's the end of life or not. How do you tell that? So how do you tell that at the end of life? I'm not sure that you can. I don't think that you can.
Wow, that's a bold statement. But Since he's not actually a medical doctor, maybe he doesn't know. How many times have loved ones been called to a hospital or nursing home because a death is imminent? It happens all the time. There is such a thing as doctors making a prognosis. This medical text explains it. It's a prediction of an outcome, an expression of what's likely to occur. A prognosis of grave means that death is likely. So, if a prognosis is not a thing, why is it in this medical text? Why is Dr. Campbell saying that you can't tell if someone's going to die?
And have even, so moderate to severe breathlessness. So some people even with moderate breathlessness. So people that might have looked ill but had a virus that their immune system could have overcome and they could have recovered, could well have been given these medications that resulted in suppressing their breathing.
He can't seem to separate treating someone that's ill and someone that's dying. This medical text explains the circumstances when someone is considered dying. A patient is terminal when there's no possibility of a cure and their condition is declining and death will be the result. From then on, treatment is not to cure but rather relief of pain and distress. Dr. Campbell must know the definition of a terminal patient. He is reading from the section 6.5, which is for terminal patients. He just keeps suggesting those drugs were given to everybody with shortness of breath.
This is probably the most concerning part of this, really. Sedation and opioid use should not be withheld because of fear of causing respiratory depression. It's almost like saying the respiratory depression is acceptable. And I actually found this quite alarming.
This is a joke. This text is only found in section 6.5, outlining end-of-life treatment. And he finds it concerning and alarming that it says that. This medical text agrees with section 6.5. In palliative care, it is often a matter of balancing the unwanted effects of the disease process with the side effects of the treatment. So, basically, Dr. Campbell doesn't believe a doctor can form a prognosis. He doesn't understand when a patient becomes terminal, and he finds it alarming that a terminal patient is given relieving drugs that may have side effects, going against the medical text I showed. This is just another case of cherry-picking one small part of a document and misapplying it. Anyway, to finish off, I just want to give credit to the author of the medical text I drew from.